The Use of Selective Serotonin Reuptake Inhibitors as a Treatment for Depression by Sam Lewis and Hannah DiGiorno.
In this presentation, we will be discussing the role of selective serotonin reuptake inhibitors in the treatment of clinical depression. We will begin by giving an overview of depression, then we will go into details about the mechanisms and side effects of selective serotonin reuptake inhibitors. So what is depression? Depression is a clinical disorder that is characterized by disturbances in one's mood, loss of interest or pleasure in activities that they once enjoyed, and it is accompanied by feelings of profound sadness and hopelessness. Depression can also cause changes in an individual's sleep patterns, appetite, and their ability to concentrate. Major depression is one of the most common mental disorders in the United States. In 2015, an estimated 16.1 million adults aged 18 or older in the U.S. had at least one major depressive episode in the past year. This number represented 6.7% of all U.S. adults.
The most common treatment for depression is selective serotonin reuptake inhibitors. You may have heard of a few of these, namely Prozac, Zoloft, or Lexapro. Although they all vary slightly in their effects, they mainly perform the same role in blocking serotonin reuptake by neurotransmitters. Here are some more details on how they work.
Hello, my name is Dr. Carlo Carandang, and I'm a psychiatrist. Today, I will talk about how SSRIs work. SSRIs, otherwise known as selective serotonin reuptake inhibitors, are antidepressant medications which work by increasing serotonin in the synapses in the central nervous system. So here we have a picture of neurons. Here is the presynaptic neuron, and here is the postsynaptic neuron. So neurons communicate with each other via the synapse. So what happens is serotonin is located in vesicles in the presynaptic neuron, and serotonin then is released into the synapse. The serotonin then travels across the synapse, which is unloaded from the vesicles from the presynaptic neuron, and this travels across the synapse to bind to postsynaptic receptors here, and this in turn continues the signal to the neuron postsynaptically. So how serotonin then is recycled in the synapse is that after serotonin is released into the synapse, it is also reabsorbed back into the presynaptic neuron here. So that is how serotonin is released and how serotonin is reabsorbed. And this thereby completes the communication between the presynaptic neuron and the postsynaptic neuron. So when you swallow an SSRI, it goes into the bloodstream, then it travels to the brain, and it travels to the synapse. So here you have SSRIs here, which travels to the synapse. It actually lodges itself in this reuptake pump, and it blocks the reabsorption of serotonin into the presynaptic neuron. So when an SSRI blocks the reuptake of serotonin, what happens then is that there is an accumulation of serotonin in the synapse, and thereby it increases the concentration of serotonin in the synapse, thereby increasing the binding of serotonin to the postsynaptic receptors, thereby increasing the signal postsynaptically. So this is how serotonin is increased when you ingest an SSRI. SSRIs work by increasing serotonin in the synapse. And this works, SSRIs treats depression and anxiety hypothetically by this mechanism where there is an increase in serotonin, where you have so-called serotonin deficiency states as in anxiety and depression. For more information and help on SSRIs and anxiety, please visit anxietyboss.com. Thank you for listening. I'm Dr. Carlo Kerneg.
Another major discovery in the effect of antidepressants involves neurogenesis in the hippocampal region. Many studies have noted that patients with depressive symptoms often have smaller and underactive systems within the hippocampus. This is observed through various medical scans. However, it is also noticed through decreased cognitive performance, memory, and other associated functions of the hippocampus. If antidepressants simply increase serotonin availability, then they should yield an almost immediate improvement in symptoms. However, they can take 2 to 4 weeks to begin to induce their effects. Studies reveal that these antidepressants are actually causing neurogenesis specifically within the serotonergic and noradrenergic systems of the hippocampus. One study even showed that when the growth of these systems were inhibited, antidepressants did not induce the desired effects. This is suggestive that the overall neurocommunication within the brain, and specifically the hippocampus, may be the major biological cause of depression rather than a simple chemical imbalance. Although antidepressants can be successful for treating symptoms of depression, they also come with many detrimental side effects.
Some of the mild side effects of antidepressants include nausea, increased appetite and weight gain, loss of sexual desire, fatigue, and insomnia. When a person starts taking antidepressants, these mild symptoms appear early on and tend to go away over time. In a study that observed 700 patients that were taking antidepressants, specifically selective serotonin reuptake inhibitors, 38% of the 700 patients reported experiencing at least one or more common side effects. A few of the most commonly experienced side effects included sexual function, sleepiness, and weight gain. Some of the more serious side effects of antidepressants include involuntary bodily movements, such as muscle spasms and tics, an increase in their suicidal thoughts, mania, and a fatal condition called serotonin syndrome. Here's an example of patients that have experienced severe side effects after taking antidepressants.
I was an absolute mess, wanting to take my life like continually. I read the leaflet and I was getting exactly what it said. You know, I was getting kind of seizure-like symptoms where my muscles were kind of jolting around of their own accord, and I felt disorientated and sick and had digestive problems and infections, and I mean, it's really, really extreme.
One in 4 people become more anxious rather than less. And they can become extraordinarily anxious, so that some people become very agitated and some go on from that to become suicidal.
Oh, here we go, I'll take off in a minute. Breathe. Yeah, that guy is, there we are, that's what he's doing. I can stop it, but if I do, then somewhere else goes. Oh.
I think with people with severe depression, you may well need to try 2 or possibly 3 before you find one that does work. But for most people with severe depression, we can find a medicine which will help them and where the benefits will outweigh the risks.